Get an informed guide to the global outbreak with our daily coronavirus newsletter. The United States recorded its first 2 deaths attributed to the coronavirus over the weekend, as states from coast to coast reported new infections, leading to a drastic jump in the total number of cases. On Friday, there were 65 cases and no known deaths in the United States. Fewer than 48 hours later, a single hospital in Washington state reported 2 deaths, the makings of a cluster, and the total number of cases nationwide jumped 35% to 88. One state, Florida, declared a public health emergency, even as Vice President Mike Pence, tapped to lead the federal response to the crisis, sought to calm the public's nerves. Officials in Washington state said on Sunday that a second person, a man in his 70s with underlying health conditions, had died at Evergreen Health Hospital in Kirkland. That is the same facility where officials identified the nation's first coronavirus death on Saturday, a man in his 50s. Both men had been residents at nursing facility in Kirkland, run by Life Care Centers of America. Officials also announced 3 other confirmed coronavirus cases at the hospital, and another 2 in hospitals in Renton and Seattle. 23 cases were announced on Saturday and Sunday in Washington, California, Illinois, Rhode Island, New York, Florida, and Oregon. The new cases included a mix of people who had traveled to high-risk countries and those who were believed to have contracted the disease domestically. The virus has infected more than 89,000 people in at least 65 countries. Governor Andrew M. Cuomo on Sunday confirmed New York State's first case of the coronavirus, saying that a woman contracted the virus while traveling in Iran and is now in New York isolated in her home. The patient has respiratory symptoms, but is not in serious condition and has been in a controlled situation since arriving to New York, Mr. Cuomo said in a statement, offering no details on the woman's whereabouts. Updated February 26, 2020. A New York State official said that the positive case was in Manhattan. The case is the 32nd tested from New York. All of the previous cases had tested negative. No cases are currently outstanding. New York State Lab was granted the ability to test for the virus on Saturday after an appeal from Mr. Cuomo. There is no reason for undue anxiety. The general risk remains low in New York, the governor's statement said. We are diligently managing this situation and will continue to provide information as it becomes available. In San Antonio, Texas, a patient who appeared to recover from the coronavirus illness and had been released from a healthcare facility after having tested negative twice in more than 24 hours was placed back into isolation after a subsequent sample tested weakly positive, according to the CDC. Health officials were tracing potential contacts the person had while outside the facility, even though it was not clear that the patient would have been able to transmit the virus. In a statement, Mayor Ron Nirenberg called the situation unacceptable and said he would hold the CDC responsible for allowing the patients to leave the facility. Similar cases in other countries have raised questions about whether a relapse of the illness is possible. Experts have suggested that fragments of the virus can remain in the bloodstream and be picked up by sensitive tests even after a person's immune system has destroyed the virus's capability to infect anyone else. Testing errors could explain the test results. Stocks rose in Asia on Monday morning as investors made bets that the world's governments and central banks would step in to help a global economy slammed by the coronavirus outbreak. But U.S. Treasury prices rose, driving yields lower, in a sign of growing worry in the financial world. After opening lower, Japanese stocks rebounded, and the Nikkei 225 index was up about 1.4%. The rise came after the Bank of Japan, the country's central bank, said it will strive to provide ample liquidity and ensure stability in financial markets through appropriate market operations and asset purchases. It did not announce any specific moves. Hong Kong shares also rebounded and were trading about 0.9% higher. Shares in Shanghai, a market that often gets support from state-linked investment vehicles, was up 2.9%. Futures markets indicated investors expect Wall Street and several European markets to open higher later on Monday. Yields on the 10-year U.S. Treasury bond fell to 1.08%, edging closer to the psychologically important 1% threshold. The drop, driven by rising bond prices, suggests investors are still looking for safe places to park their money, as well as the expected move by the Federal Reserve. The higher opening for stocks followed one of the worst weeks for global markets since the financial crisis, with several major indexes around the world falling more than 10% in just a few days, a stunning decline that came as investors grappled with the potential economic toll the outbreak could take. 2 healthcare workers in the San Francisco Bay Area tested positive for the coronavirus after they were exposed to a patient now being treated for the virus at a hospital in Sacramento, the authorities said on Sunday. The workers' conditions were not immediately available, but public health officials in Alameda County and Solano County said in a news release that the workers were isolated in their homes. The news came after new cases were reported in both Washington state and Rhode Island. Alex M. Azar II, the Health and Human Services Secretary, said on CBS's Face the Nation on Sunday that the government planned a radical expansion in testing capacity. Globally, the number of infections has risen to more than 88,000. China reported an additional 202 infections and 42 deaths from the virus, bringing its total number of confirmed infections to more than 80,000 and total of deaths from the virus to exceed 3,000. Do you know anyone who lives or works at Life Care Center in Kirkland, Washington? If so, please email our reporter, Mike Baker, at mike.baker@newyorktimes.com. Reporting was contributed by Russell Goldman, Sherry Fink, and Mitch Smith.